Good afternoon, Hattiesburg. Thanks for joining us for this Tuesday afternoon briefing for COVID-19. Today we'll talk about testing numbers. We'll talk about some increases that we're seeing and a note about the number of cases we're seeing inside 14 days. Today's numbers, these are for four of our healthcare organizations: Hattiesburg Clinic, Forrest General, SEMRI, and of course Merit Health Wesley. As of this morning, 25,564 tests have been conducted. 2,349 of those have come back positive. Of course, those are not all in Forrest and Lamar counties, and they're not all active cases. 21,800 have come back negative. We have 1,415 tests that are currently pending. Right now, 53 people are in the hospital between Merit Health Wesley and Forrest General who are positive for COVID-19. That's about 9 over the average for the last 14 days. We have an additional 24 who are under investigation. In the ICU, we have 23 patients. That's one down from yesterday, but still well over what we've seen. And so I want to make this statement again that I made yesterday. After we kind of look at this slide, you see the total hospitalizations have jumped well over 50 now. We're also seeing ICU admissions kind of still at a high point. And well, as we said yesterday, our local hospital system is now seeing the highest number of COVID-positive patients thus far, particularly in the hospital, that we've seen. Went from 51 yesterday to 53 today. And so that's a number we have to keep an eye on as we go forward. In terms of new positive cases, Forrest County both of our counties had big days today. 38 new positive patients in Forrest County, 26 in Lamar, so additional 64 people were reported as positive in the Hattiesburg metro area. That's a high number since this started. That brings the total to 916 in Forrest County, 491 in Lamar County, 1,407 in the metro area. This is our 5-day average. This is where we look at the number of new positive cases on a single day. We average it with the 2 days prior and the 2 days after. As you can see, Forrest County is not at its highest point for 5-day average. It's between 15 and 20, but Lamar County's getting close to its highest point that we've seen in the last several days. And so those two things combined have taken our entire metro area total almost to 30 new positive cases per day, rolling 5-day average. So another factor we look at is the number of people whose tests have come back positive in the last 14 days. Because this disease has a life cycle of 14 days or fewer, this is a general estimate on the number of active cases you have in your community. I will give this caveat, however. Just because a test comes back in the past 14 days, it doesn't necessarily mean that they tested positive on day one. And so what you likely see is, even though these number of tests have come back in the past 14 days, their quarantine date may be sooner than 14 days. And so again, this is just a very rough estimate on the number of people who could have active cases in your community. And so right now, 178 people have tested positive in the past 14 days. In Lamar County, that number is at 138. When you combine those two, obviously Forrest County is not at its highest point in terms of inside 14 days, but it's up there. But when you take into Lamar County's number under about 138, that the total combined over 300 now whose tests have come back positive in the past 14 days. That's a new high for the metro area. Again, doesn't mean they're all positive right now, because some their quarantine date could have ended days ago. But still, a high number that we need to keep an eye on and be aware of and take seriously. Because going back to our goals, we want to make sure that we're protecting vulnerable populations. We want to make sure that we're preventing overrun of the healthcare system by slowing the spread, which is why we keep an eye on that hospitalization number, that ICU number, and then continue prioritizing public health so the private sector can stay open. 4 factors that we lean on: widespread availability of testing that's out there, the wearing of masks that we talk about every day, watching our own data, listening to all voices. I'll say this: hard decisions are ahead, and I mean that kind of from a statewide level. If you haven't seen Dr. Dobbs' press conference today, you can kind of sense, with over 900 new cases today statewide, that he is feeling this. And so if you haven't seen that press conference, I encourage you to go to the Department of Health's Facebook page and watch this, because he really gets into a lot of detail. Some of those hard decisions he made today. He limited elective surgeries in 5 counties, one of which was Forrest County. I know that which affects Forrest General Hospital, and that affects a major part of our healthcare economy. And I know Forrest General is working through that process to try and have that limitation lifted soon. But those things come back to us in terms of the individual and collective decisions we make. We can directly affect the future, at least locally, with our individual and collective decisions. If we want to see those elective surgeries brought back, if we want to see students back on campus at Southern Miss and William Carey this fall, if we want to see high school and college sports, then we individually have to engage in good behavior, whether it's wearing a mask or whether it's avoiding large crowds so that we don't possibly get infected, whether it's social distancing so that we can limit the exposure for ourselves. All of those things combined work out so that we can avoid some of those really hard decisions. And I'm not talking to just Hattiesburg residents. I mean, this message is for those who live in the county, those who live in Petal, those who live in Lamar County. What affects our hospital, what affects our numbers, is a total metro area effort. And so again, we can directly affect the future with our individual and collective decisions and avoid some of those hard decisions that could be coming down from the state. And so as we go out today, just remember to wash your hands, take care of yourself. Please wear a mask if you go out in public. Do only what is essential, and remember, you're safer at home. And I want you to know that we give you this information not to scare you, not to alarm you, but just to make sure that you have information that's accurate. We give it to you and we have it. And so we hope that you find these updates informative, and we hope that they can guide your everyday decision making. But I hope you have a great day, and remember, courage.